Have you ever wondered why some people seem to recover from trauma, while others struggle for years? Today, we're delving into the fascinating and sometimes perplexing world of PTSD, post-traumatic stress disorder, and distinguishing between acute and chronic cases. Stay tuned, because what you're about to learn could forever change the way you perceive trauma. Welcome to Wellness Lenses, where every conversation is a deep dive into mental wellness. If today's topic is something that appeals to you, please consider subscribing to our channel for more content on mental health and psychology. So let's begin with the basics. Imagine you're walking down the street when a car swerves in front of you. Your heart races, your palms sweat, and you experience a rush of adrenaline. This is your body's natural response to a threat. But what if this response does not go away? What if that moment continues to haunt you even weeks later? Here's where acute PTSD comes into play. Acute PTSD typically develops within 3 months of the traumatic event. It's as if your brain's alarm system becomes stuck in the on position. You may experience flashbacks, nightmares, and severe anxiety. Intrusive thoughts, avoidance behaviors, mood swings, and heightened arousal are some of the additional common symptoms. Unlike chronic PTSD, acute PTSD often responds more quickly to prompt and appropriate treatment, such as trauma-focused therapy and support from loved ones. Early intervention can have a significant impact, allowing people to regain a sense of normalcy sooner. So what about chronic PTSD? This is where things become a little more complicated. Imagine carrying the same fear and anxiety for years, even decades. Chronic PTSD can last for more than 3 months after the traumatic event occurred. It has the potential to fundamentally change your perspective on the world and yourself. People with chronic PTSD may experience long-term symptoms such as persistent flashbacks, severe anxiety, and emotional numbness. This prolonged state of distress can lead to other issues such as depression, substance abuse, and relationship problems. As you see, acute PTSD is frequently associated with a single traumatic event, whereas chronic PTSD can be caused by long-term or repeated exposure to trauma, such as ongoing abuse or multiple combat experiences. People with acute PTSD may experience more immediate and intense symptoms, but they also have a better memory of the traumatic event. Chronic PTSD, on the other hand, can cause more widespread problems such as feelings of hopelessness, detachment from others, and a higher risk of developing other mental health disorders. Furthermore, chronic PTSD is frequently associated with significant changes in brain function and structure as a result of long-term stress, complicating recovery. But why does this happen to certain people and not others? Well, it is a combination of factors. Genetics, the severity of the trauma, and one's support system all play important roles. For example, someone who has experienced repeated trauma, such as a soldier in combat or a victim of long-term abuse, is more likely to develop chronic PTSD. Treatment for chronic PTSD can be more difficult, but it is entirely possible. Some of the most effective treatment modalities include cognitive behavioral therapy, or CBT, eye movement, desensitization, and reprocessing, or EMDR, and medication. The journey may be long, but recovery is within reach. If you have experienced trauma or know someone who has, please share your stories in the comments. Let's start a conversation and break the stigma associated with PTSD. Your story could help someone else on their journey to healing. Remember that understanding the distinction between acute and chronic PTSD is the first step in providing support to those who are affected by it. Whether it's been 3 months or 30 years, help is available and recovery is attainable. Thank you for joining us today. If you found this information useful, please like, subscribe, and click the notification bell to ensure you don't miss any of our upcoming videos. Don't forget to share your thoughts and stories in the comments section. We're here to support one another. Also, if you've made it this far, a special thank you to you. In case you missed it, we're now on Substack. You can get free summaries of each video if you subscribe, and if you want full details of each video's topic, with references and helpful resources, we offer a paid subscription for a small fee. Just click the link below. See you in the next video.